Victoria and I run a company called Health at Hand. I'm going to demonstrate Swedish Massage today, which normally takes 1 hour. It is good for boosting circulation, lymph drainage, to release toxins and to thoroughly relax the mind and the body. Those who should not have Swedish massage are perhaps the very elderly, the frail, those with very high blood pressure or recuperating from recent operations, or those pregnant ladies who would find it difficult lying on their stomachs. The purpose of today's programme is to give you an insight into what happens when visiting a therapist and to give you a few hints to be able to massage yourself or your family. When finding a good therapist, make sure they are qualified and insured. They should make you feel welcome and give you a thorough consultation before treatment, and you should be able to get on with them. I hope you enjoy the programme and find it helpful. I'm now going to demonstrate the Swedish massage, always working at the front of the body first of all, starting on the right leg, using plenty of oil to massage upwards, firm massage upwards towards the heart. This movement is called effleurage, and pushing any toxins down the quadriceps, upwards towards the lymph node in the groin area, called the inguinal lymph node. And there again, using my knuckles to push any toxins upwards along the hamstrings at the back of the thigh. Nice tug to stretch the leg, keeping the client completely covered apart from the limb being massaged. When massaging any of the joints, it just feels the most wonderful feeling, like you're really warming the area and at the same time draining the area of any toxins. Using my thumbs here to push any toxins from this area and then down to the lymph node at the back of the knee. Moving on to the ankle, giving the joint a nice mobility circling there, sometimes feeling them crunch at the same time, and then smoothing out all the toxins around the joint. It's a lovely feeling when you have your ankles massaged. And then coming up the foot, doing my petrissage movement between the metatarsal bones which connect the toes and along the feet, and then pushing all those toxins away. That can be quite a painful massage for the client, but you need to get rid of those toxins. And then coming down, massaging behind the foot here. It's a beautiful movement, nice and firm and stretching the toes. That movement will massage all the nerve endings, and in line with the metamorphic technique and reflexology, it will massage all the energy lines. Lovely feeling as stretching up the foot. And then massaging each toe individually. So it's a massage down a nice mobility circle, and then a gentle tug. Nothing too much. You don't want to hear a click unless the toe wants to click. Now moving on to the left leg. Again, only revealing the limb that needs to be massaged. Introducing myself to this side of the body with the effleurage movement, using plenty of oil, otherwise the skin tends to stick to the hand and it will rub too much friction. And as you can see, a nice pull as you come down. So firm upwards, lightly down, and then a little tug. Moving the knee up. And again, massaging down the quadricep. And along the back of the hamstrings. Always working outwards towards the buttock. Working on the left knee. That lovely movement, pushing all the toxins away and down. It's strange, sometimes you can feel crystals around one knee and not around the other. Maybe someone has arthritis or another joint problem, and that just feels wonderful when it's being massaged. You can do a great deal of help around joints. And a nice circular motion around the ankle, a nice tug, and move the crystals again downwards to the back of the ankle. Pushing all the toxins down through the metatarsal bones. And then the back of the foot. A nice stretch. Wonderful feeling. The secret here around the foot is not to be what I'd call a wet lettuce, which is no gentle movements. You need to be nice and firm, otherwise people can be very ticklish around the sole and the toes. You just need to be nice and firm so that the person knows where you are all the time. Nice stretch down the back of the foot. Lovely. Having finished both legs, I can now cover them up, make them feel nice and warm and secure, and also get a handy pillow, raise the knees, and put the pillow under the thighs and knees down, and that makes the client feel very secure and it releases any pressure from the lower back. How does that feel? Good. All right. Okay, now moving on to the stomach area. As you can see again, only the area of body being massaged is revealed. Just getting some oil. Warming the oil in my hands and introducing my hands to the body. One note to make about all of these massage areas is that you'll notice that I never remove my hands from the body. I'm always in contact. One hand is always in contact, apart from when I finish an area or if I have to adjust towels. The stomach area demonstrates why a therapist needs to know anatomy and physiology in depth. The reason is with the stomach is obviously the colon works from this area in an upside down horseshoe round and down here out to the bowel. There's an ileocecal valve here which works from the intestines, and the ileocecal valve can get blocked, so this is a nice area just to massage in this direction, never in the other direction. So upwards here from the small intestines to the colon. And then what I'm doing is following the colon round. It's a nice movement, very relaxing. It can relieve a lot of stomach upset in children or adults. And then doing some back sweeps. And down the sides, and a nice pull up over the hips. Nice and firm. Again, the hips are a joint and they love being massaged. It's a nice area to massage. They can spring, or they should spring, so when you pull them together they should spring apart slightly. Lovely. And then a nice stomach effleurage around the stomach to finish off. That's nice. Okay, how did that feel?
That was lovely.
Good. Okay, now working on the left arm. Just reveal the one limb, making sure the body's nice and warm in there. And introducing the oil to the body. Just using a bit more oil there, always keeping contact. And now bringing the arm up. Which is a nice movement because gravity is helping you to push all the lymph down towards the lymph node under the armpit, which is called the auxiliary lymph node. And this is a nice movement, again for mobility. You'll notice that quite a lot of Swedish massage is working on the mobility of the joints, not just massaging the body. That's a nice one for the shoulder. And again, flexibility. Just let your arm completely drop. Wonderful. Lovely. The floppier the better. Okay. Gentle tug and release. Lovely. And this is a wonderful movement down the forearm. When we work on computers or other manual jobs, we're working very much with the tendons down the forearm here, especially with computers where you don't put your wrist down or your elbow. You're raising your whole arm from your shoulder, and it puts a lot of pressure on the forearm here. So this movement is lovely to drain all the fluid and release all the pressure that builds up subconsciously. Just release the pressure there, lovely. And I'm draining all that fluid down. And again on the other side. Nice squeezes and then drain. You'll notice that when I do that, the fingers tend to curl because I'm working on the tendons there. They do that automatically. And a nice pull, another reflexology as normal, and then working on the wrist and the hand. So before I do that, just covering the arm up, keep it warm, coming round, nice rotation on the wrist, and again just like the ankle, the rotation and then the massage around the wrist there. Beautiful movement, always pushing the fluid to the back because there's the lymph nodes that work all along here, and the nearest lymph node to the end of the hand and the fingers here, the nearest one is here, and then another one under the armpit, and this one has to drain and eat all the fluids, all the toxins from the rest of the extremity here, so hence pushing all that fluid upwards. It's a lovely feeling. Now I'm working just the same as the foot, pushing the fluid between the metacarpals as opposed to the metatarsals, and a nice massage, rotation, and a gentle tug. This one really feels lovely. We have so many nerve endings in our hands and fingers that when we massage them, it is so relaxing. If they happen to click, it doesn't matter. Obviously the finger or whatever joint needed to be released. But when massaging, I'm not looking for clicks and just hoping to release any extra tension there. The one nice thing about massaging fingers, as you can see here, is Pamela normally wears rings on this finger, and it's nice to massage that area. It's such a lovely feeling when you have an area massage which normally completely protected by jewellery. Normally ears and fingers are the lovely areas to massage. Lovely. And turning the palm over, stretching the hand out, and using my thumbs to massage alternately the centre of the palm. This area in reflexology terms is called the solar plexus, which on our bodies is actually up here, and it's the centre of our emotions, our feelings, whether we feel stressed or happy. And it's such a lovely area to massage and have massaged. And a nice stretch and off. And covering the limb. How did that feel, Pam? Yeah, good. Now I'm going to turn Pamela over. So Pam, if you'd like to turn any way. Okay. I'm going to remove the pillow. Wonderful. Okay. Now revealing the back of the leg, ready to massage the back of the client. Okay, just move your hands slightly. Wonderful. There we are. The oil I'm using, grapeseed, is especially good for people who don't want to put on weight with the massage, because unfortunately some oils will absorb into the body and add fat to the body. And the other good thing about it is it's not at all gloopy. It's a nice thin oil to use, and it goes nicely onto the skin. There we are. Using that good old effleurage again, and then working on the lower leg. First of all on the Achilles tendon, and then working up the back of the calf muscle. There's actually a few muscles here, but the main one is the gastrocnemius muscle, which has 2 heads and 1 foot. So when working up, I'm able at about halfway to apply pressure with my thumbs into the centre, where there's normally a pool of lymph, if you like, which is the white blood cells eating up all the toxins, and I'm pushing them upwards and to behind the knee here. There's another lymph node here, just like behind the elbow, and again that's the nearest one to the extremity, so hence why I'm pushing up all toxins up to the back of the knee. Working up to the inner thigh. First of all sweeps, then some kneading. This is a wonderful massage, really feels like you're getting deep into the muscle, and by this stage the hands and the part of the body being massaged are really nice and warm. There's a lot of energy following the hands around the body. And then some squeezing motion by picking up the muscle. And effleuraging up, this is where I move round the couch and work on the other side of the upper thigh. And again, some squeezing. You all right? Yeah. And some kneading. And then on to some of the percussion movements. That's a nice feeling. Though the first one there was called cupping, and the second one is hacking, both called percussion movements. Now with some new oil on my hands, massaging up the side of the hip and up to the buttock. As you can see, I'm using my thenar muscle here, nice and strongly, to bring the circulation upwards and into the centre of the buttock. Using a new technique here called petrissage, massaging firmly into the centre of the buttock. 3 nice swipes. And some squeezing. Some kneading. And eventually the percussion moves. As you can see, the area's just slightly rosy all the way up the thigh to the buttock, which is a good sign. That's wonderful. That's what any therapist is after, and it means the circulation is coming to the area with oxygen and nutrients, helping to heal the area, get the circulation back in again. Okay, and coming round, and then a nice long effleurage again to tell the whole leg I'm still there, and then raising the lower leg, again using gravity work for me, and some nice sweeps down the back of the calf muscle, and then applying some pressure to the sole. Coming down slowly, a gentle tug, and sweeping up and off completely. Okay, so revealing the back, tucking the towel in, and applying some oil. Just a little at first, ready to stretch the back and the spine. Okay, Pamela, would you be able to give me a nice deep breath, please? That's a wonderful movement for the spine and for the erector spinae, which is a muscle which works each side of the spine here, and it stretches all the vertebrae out in a movement that you can't achieve yourself. You have to have someone doing it to you. It's just a wonderful feeling. Lovely feeling there. It's nice with the out breath. Wonderful. Okay. And a little more oil. It's amazing how much oil will absorb. You may need a little more oil than you think, depending on the size of the body or whether there's a lot of hair on the body. Okay, so wonderful movement, stretching all the way up the back. Obviously this is the effleurage again. Now you'll notice I'm using my palms mainly. I'm not pressing my fingers in. The palms do all the work. Very strong palms. Pushing upwards, always upwards. And always encompassing the shoulders, as so. And then coming up to the shoulder. Just want to raise your arm, Pam, and I'm going to hold it there for you. You can release any tension. Wonderful. Making sure I've got plenty of oil on the scapula, which is the shoulder blade here. There's a muscle here as well, which is a diamond-shaped muscle, working from the lower neck, diamond to the shoulder, down to this part of the back, over to the other shoulder, and up to the neck again. And this is the muscle which gets a lot of tension, a lot of pressure from the body without being released. We could really do with regular massages. Weekly would be wonderful, but if not, fortnightly or monthly to release this muscle. And that's just a wonderful feeling when you have it massaged. Okay, so working specifically on the scapula, doing a crisscross movement, and then in that chessboard, doing some deep petrissage movement in each of the squares. And this is where you normally find crystals, lumps and bumps, builds up of lactic acid. Lactic acid is caused through not stretching properly after exercise and through stress. And I'm talking about physical stress and tension or mental. Wonderful. Okay, and releasing all that pressure. Nice palm movement over the shoulder. Okay, and releasing the arm back down again. And a little more oil, ready to do the other shoulder. Okay, Pam, I'm just going to raise your arm again. Okay, I've got the pressure here. You just release. Oh, wonderful. You can see that the scapula raises when I raise the elbow there. So it makes it much easier and more prominent to work on. Lovely. I'll be working on the shoulders more thoroughly later. This is actually to do the back of the shoulders as opposed to along the ridge and the shoulder point. It's nice to drain all those fluids that collect underneath the scapula there as well. Pushing them across and following the line up and over. We have a lymph node in the chest out here called the subclavian vein, which collects all the lymph from that part of the body, from the upper half, so we need to push it up, over and collect in the front. Okay, now to the chestboard again. That's it, relax your arms down. Introduce your hands back to the body again. Just need a little more oil. Amazing how much you use during a massage. Okay, that's nice. And now coming round to do some more percussion moves round the circle of the body. First of all, some squeezing, like you've seen earlier on the legs. There's actually, on everyone, a nice amount of body you can work with around this area. And it's nice to pick it up. It feels nice when you're having it done as well. Nice to pick it up and massage it. Okay, and then coming round and kneading, just like before. And onto the percussion moves. And the hacking. And back to the effleurage, calm the body again after some quite physical movements there. and then working on the spine. Okay, coming down to the bottom of the spine, working on the sacrum, base of the spine here. It's not actually the end of the spine is the coccyx. It's the next few bones up which are fused together. And this area is like a plate of bone, and it quite often harbours toxins, and it's a wonderful feeling to have it massaged in that area, so that upside down triangle. Wonderful. Okay, and then working up from there, up through the lumbar, over the thoracic. Normally quite a lot of tension in that area. And then coming up to the neck and the cervical, which is the cervical vertebra, all the way up to the top of the neck. Nice feeling. Now I'm going to use a different move called vibration. The nerve endings are each side of the spine as well, and this move relates to the nerve endings, wakes them up. I'll do that one again. Lovely. And now finishing off with a hip stretch. And a thoracic stretch. And a shoulder stretch. As you can see, I'm pulling the shoulders back. Nice feeling. Always start and finish with an effleurage, and I always end with a stretch as well. Having wrapped the feet and put the pillow back underneath the knees, now going to continue with the upper half of the body. Going to start on the chest, moving on to the shoulders and then the neck. So introducing the hands to the chest area, putting oil all over the area, and a lovely flowing effleurage movement, working down over the clavicle, down the sternum, over the shoulder points. Nice firm movement underneath and pulling the neck. As you can see, I'm literally pulling, which is a lovely stretching, releasing movement for the whole spine. Nice feeling. It's very important to keep the towels covering the body, so I normally make a line to show the client where the towel comes to, make them feel nice and secure. Okay, so having put the oil on, and now doing a nice knuckling massage over the chest and round the shoulders. This area collects a lot of tension, so it needs a good firm massage. But having said that, when starting, the massage needs to be just warming and not too pinpoint firm, just nice whole hand firmness. Otherwise, there's a tendency to hurt the muscle. Okay, so another knuckling session. Around the chest, over the shoulders, and even including the neck. Nice feeling under there. And a stretch. Now I'm going to work on the chest area here. This movement is called tapotement, which is a French word literally meaning to tap. And even though this is a very light massage, it decongests the upper chest area all the way to the lungs of any toxins. Very good for any chest problems, bronchitis, asthma, even down to a sore throat and a congested chest. And turning the head, just relax completely. The more you relax, the more you'll benefit. And then stretching round the shoulder and just gently pulling the head up. I've got my hand underneath the other side of the head, so I'm completely supporting the head here. And having effleuraged, I'm now going to do some more knuckling. At first with the whole of my hand, all of my fingers are knuckling together. This area is very, very sensitive. A lot of tension here normally, and this is where you can feel great boulders, depending on the person. Not too bad here, just a little bit of tension that needs to be released. So I'm using my thumb on its own to go in a little bit deeper. The deeper I go, the slower I go, because it tends to be a little bit more painful. And then a nice stretch, effleurage out to bring all the toxins that I've just massaged out up and bring the head back. And now I'm going to work on the other shoulder. So effleuraging round and pulling the head to this side. So now coming round to the left shoulder. A nice warming effleurage over the whole shoulder. And then coming in to do some knuckling around the shoulder, underneath, and around the back of the trapezius muscle. And coming around again, this time using just my thumb. That's nice. And a nice effleurage, bring all the toxins up again. Okay, coming round to the neck, just going to do a nice neck stretch. I'm lifting Pam's head here myself. And coming up gently, and I'm using my 2 fingers each side of the spine and bringing up all the fluids, any toxins, bring them up each side of the spine and up around the neck here. Lovely feeling that is. And down. That will be different depending on the person and their flexibility. And then just finishing, coming up around the scalp and off. Just doing a nice finishing touch here where I hold the shoulders down, I hold them down and in, and that releases any pressure. And because I've covered the client up, it tells them that that's the end of the massage. This is a typical Swedish massage, which is the whole body and stops at the neck, whereas with other massages or with different courses, you are able to train to do the face and the scalp around the back of the head as well, to make it more thorough. But with this one, the Swedish massage tends to stop at the neck, and that would be an hour's massage. So having completed the full body massage, I'm now going to talk you through doing a 3-minute self-massage. You take the thumb of one hand and massage in a circular motion in the centre of the palm. And then come up the fingers, give them a nice circle and a pull. Okay. This is wonderful to boost the circulation, and you feel all the nerve endings tingling. Okay, so that's a nice one for the hand. Then coming up the forearm with the same thumb, work nicely, pressure going upwards up the centre there, and you're pushing all the lymph up to the elbow. Lovely. Then coming down to the foot, I want you to massage first of all the whole of the upper foot, like that, again with the thumb. The thumb does a lot of the work for you. And then exactly the same that you just did to the fingers, do to the toes. It's a nice massage to do. Good for mobility and flexibility. You getting the hang of that?
Mm-hmm.
Okay. And then maybe a little bit around the ankle bone. A bit more difficult to do it to yourself, but you'll get the knack of it. Okay, coming up to the knee. And maybe you can do 2 knees at the same time. It can be through clothes, it doesn't matter. And then put your thumbs again in a circular motion round your knees. And as you come from underneath, pull any toxins around and back to the behind the knee, like that. Okay. And then coming up, we're going to do a quick one on the stomach, but again through clothes. So we're going to start on your right hand side, and then upside down horseshoe all the way over and press down to the bowel here. So nice movement like this. That's it. 2 hands is better, you can apply more pressure. Okay. And then coming up to the shoulders, and we always use the opposite hand to the opposite shoulder so that you're not tensing the shoulder at the same time. So like that, that's wonderful. And then start at the shoulder point, use the whole hand this time. Nice gripping motion, grip the fingers around the muscle, and then over onto the top of the trapezius, the muscle on the top of the shoulder here, and really grip it, and you'll feel a lot of tension there. Wonderful, you're doing well, you're stretching the neck at the same time, that's nice. And the same on the other side, so start at the shoulder point and up. And then we're coming up to the neck, 2 hands around the back of the neck, and put your head forward and then back into the massage. Put it right up, wonderful. Maybe another one, nice long sweep up the back of the neck and pull your hands up, that's right. That's it, wonderful. So a nice sweep upwards, wonderful. And then coming up the front of the neck, we're going to give ourselves a facial massage, just a bit on the chin and the cheeks. Up the nose, just with a finger. That's it. And then nice one on the forehead. Coming round, doing the temples, lovely. Okay, around the eyes, just with a finger. Lovely, all the way up. That's it. So we always come into the nose, up between the eyes. It's always that motion. And then finish on the temples. Lovely. And then very last point is up the scalp. So pick all the hair up and come up through the hair. You might want to give yourself a little massage at the back, either with your fingertips or with your whole palm, and then stretch the scalp, pull the hair. A nice one to end on. And that's just a very brief massage for any times that you haven't got much time and you just feel that you need a bit of a relax, and you can show your partner. It's a really nice one to do. So that's the end of the Swedish massage video. If you'd like more information, there will be names and addresses at the end of the video. I hope you took some tips from this and enjoyed watching. Thank you. Walk into any chemist shop and there is a huge variety of products all labelled aromatherapy, ranging dramatically in price. Most people are also aware that aromatherapy is a complementary form of therapy and that great health benefits can be experienced when it is practiced. My name is Victoria Sprigg, and as a holistic therapist, I use aromatherapy to help many of my clients with a diverse range of health issues. And throughout this programme, I'm going to explain and demonstrate what happens when you visit an aromatherapist and how you can apply certain techniques to everyday life. Aromatherapy is one of the most ancient forms of healing. Egyptian and Roman cultures certainly knew about the health benefits of aromatic plants. And by the 17th century, even the English had developed a widespread use of herbal remedies. But it is the French who are really responsible for the development of aromatherapy as we know it today. By the 20th century, perfume blending had become synonymous with France, and purely by accident, in 1937, a laboratory chemist badly burned his hand while creating new scents. He plunged his hand into the nearest available bowl of liquid, which fortuitously proved to be filled with essential oil of lavender. His injuries healed with remarkable speed, and there was much less scarring than expected. And, of course, with the inquiring mind of a scientist, he soon set to work investigating the various properties of other essential oils. These initial findings were soon put to the test by another Frenchman, a field surgeon at the front during the Second World War. Medical supplies were limited, therefore using essential oils, which were readily available, frequently proved to be an effective alternative. From this point onwards, aromatherapy became an integral part of medical practice in France, and although it has developed more as a complementary therapy in the UK, there have also been pioneers on this side of the channel responsible for increasing public awareness of aromatherapy and making it more easily accessible. Aromatherapy first came to England when it was used predominantly in the beauty business. Shirley Price herself walked past a beauty salon and noticed an advertisement for a 3-day course in aromatherapy. She was very interested to learn about how aromatherapy could treat the range of illnesses that were on the list. It was interesting at this time because aromatherapy was not known in the UK, and more ladies predominantly were using essential oils not only in their home but also as a business. This is where essential oils really became commercial. Other training schools began, other beauty clinics began, and finally it became a qualification all on its own, not just in beauty, but just as a professional aromatherapy qualification. You can use aromatherapy oils in many different ways. There are bath oils, burners, candles, beauty products, and even car fresheners that can be used to relieve stress when driving, and you'll see them demonstrated when I'm treating my clients. Although there are many books available suggesting which oils are best for treating various problems, they can be a little confusing, as the same oil can be recommended for seemingly opposite conditions. For example, both jasmine and lavender can be of great value to the over-extroverted and equally helpful under different circumstances to the painfully introverted. Also, certain oils are listed as only suitable for use by an aromatherapist, and anyone who is pregnant needs to be especially careful, as some oils must be avoided until after the baby is born. Consequently, it's always worth searching out a qualified aromatherapist to find out exactly which oils will suit your particular needs and how they should be used. However, I will just run through a selection of perhaps the best known and most commonly available oils before showing you how aromatherapy actually works. The first oil to look at is lavender, Latin name Lavandula angustifolia. You can find lavender everywhere, but make sure you get the best quality oil that you can. It comes from France, ideally mountain tops where it gets really parched. A common variety, Lavandula intermedia X CV Super, is cheaper but not as good. A wonderful antibiotic, antiseptic, antidepressant, sedative and detoxifier, it's of great help with headaches, skin problems, stress and as an aid to sleep. The only time I'd be careful of it is in the first 3 months of pregnancy when it's best to avoid it. Roman chamomile, Latin name Anthemis nobilis, is a wonderful oil, antibacterial, antiseptic, anti-inflammatory, a disinfectant and rejuvenating. It's most commonly used for the nervous system and is great for insomnia. Very calming, a useful sedative and natural analgesic, Roman chamomile is fine for everyone to use. Just make sure that you get this particular variety, check the Latin name. Not only are roses a great favourite as flowers for ladies, as an essential oil it's one of the best. Its Latin name is Rosa damascena, and in the main it comes from Bulgaria. Rose is antiseptic, a wonderful tonic, excellent for menopausal problems, depression, and helpful with the circulation. Generally speaking, it's fine for everybody, but because it works with the hormones, avoid in early pregnancy. The best way to describe it is a great big hug. Bergamot is probably best known as the flavouring in Earl Grey tea. The Latin name is Citrus bergamia, and it comes mainly from Italy and Morocco. A wonderful anti-inflammatory and antidepressant, it's also of great benefit for skin problems and is used extensively for eczema and psoriasis. It's good for serious depression and is generally fine for everyone. You do need to be aware that it's photosensitive, so avoid use in the sun. Tea tree is a wonderful oil from Australia, Melaleuca alternifolia, and has developed from Aboriginal medicine. It is antiviral, antibiotic and antifungal, so excellent for any fungal infections such as Candida and athlete's foot. It's also very helpful with acne. The only thing to be aware of is the fact that it can be an irritant on sensitive skin, otherwise it's ideal for everyone. Rosemary is a well-known herb in cooking, and Rosmarinus officinalis has many uses within aromatherapy. It's a great stimulant for both the mind and body, as well as being particularly good for the muscles and sports injuries. It can heighten mental concentration and is very popular for treating cellulite. It should not be used with high blood pressure and heart conditions, and worth avoiding with sensitive skin. Throughout history, peppermint has always been good for the digestion, and the essential oil Mentha piperata is excellent for digestive problems. It's also valuable in the treatment of respiratory difficulties, the circulation, and cleansing the liver. It's anti-inflammatory and antiseptic, suitable for everyone to use. Never put it on the skin neat though, and make sure that it's never used in high quantities. Everyone knows the smell of lemons, and citrus limon is a super essential oil. Produced in the USA, Argentina and Israel, it's a wonderful cleanser. It has both antiseptic and antibacterial properties, as well as being a water purifier. An excellent tonic, particularly for the lymph system, and a stimulant to the digestion. It's helpful for slimming, great on cellulite, fights wrinkles, and is a first-rate astringent. A perfect internal cleanser. Don't use it neat, and remember it's photosensitive. Of course, aromatherapy is a holistic treatment, and the oils can be blended, as you'll see. And we quite often recommend the addition of herbal products to enhance our treatments. So, let's see aromatherapy in practice. So Vicky, thank you very much for coming in today. What we're going to be talking about is aromatherapy for the family. Now, I know that you're a mum of two small children, so how old are they now?
I've got a daughter who's 11 weeks and a son who's 3.5 years.
Right, and how's it going with the small baby at home?
Small baby's fine. She has got a bit of a sniffle at the moment, but my son is more of a worry. He suffers with hay fever, and due to it being the pollen count this time of year, we had to go to hospital twice on Sunday because he was wheezing. Is there anything that you can suggest that I can do for him?
There is. There's something wonderful which, when you're talking about aromatherapy, there's a mixture of essential oils you can use, which you can burn either in the lounge before he goes to bed or in his bedroom, which is perfectly safe for children. Obviously, especially once they're 3, they can breathe in a slightly stronger blend. Now, the sort of oils I'd be looking at would be lavender, peppermint, and eucalyptus.
Right.
Now, what I'll do is I'll just mix a couple together for you, mix them together, and you'll be able to smell and see whether your son would get on with that vapour or not. Some children find strong oils almost repulsive, and maybe if they're flowery or quite strong flowery smells, they think it's too girly, for instance, especially for boys. So it's very important that the mother or the parent smells it first. So just opening a eucalyptus here called Eucalyptus smithii. Now I'm using the Latin names here because you can get quite a lot of different types of, say, eucalyptus. Eucalyptus smithii is a nice mild oil that can be used for children, the elderly, the infirm. So really nice oil to use for children. Now this one here is peppermint. Okay.
So it's just 2 drops?
I would put 2 drops of each. Now, when you mix it with water, I'll show you what to do. You get your vaporizer. Okay, it's got a candle inside. Light the candle. Fill with water first of all to about 3/4 level, and then add your oils to the water. Just have a smell of that, see what you think.
That is quite strong, isn't it? So.
Very strong, obviously that's neat, and that's on its own. So that's a mixture of peppermint, lavender and Eucalyptus stegariana.
Right, and do I burn it in his bedroom before going to bed, or do I put it on in the lounge?
You can do either. Obviously it'll make the bedroom smell nice for him when he comes to the room, but if you burn it in the lounge before he goes to bed, it'll be familiar for when he does go to bed, and it won't be, hey, what's going on in my room, you know?
Yeah.
So, and when he smells these oils, it'll remind him it's bedtime. So it'll also be, oh, I love these oils downstairs, I know, it's sort of my bedtime. So it's nice for him to have that familiarity.
Okay.
The good point about these oils is all of them are cicatrisant, which means that they help with the respiratory. Okay, so they're decongestant. Now, whether his hay fever is in the bronchioles and down the lungs, or whether they're up in the nose and the sinuses, or sometimes it can affect ears, even the roof of the mouth, that itchiness and burning. So obviously, especially the eyes, poor children with red eyes and watering eyes. All of these oils will help with the whole respiratory system. So we're talking the whole area. Absolutely wonderful. If he doesn't like any of those oils, no problem at all. I can add or take away one of the oils. We can bring him to the clinic and he can try a couple of oils for himself.
Right.
Okay.
What about an 11-week-old baby then? If they've got a cold, what can help with that?
Same oils, no problem, but much more diluted, just one drop. Okay. Now it's fine if she was to smell it in the lounge while he's downstairs. Absolutely no problem with that concentration. But obviously in her room I wouldn't put that sort of concentration. Maybe one drop on wet cotton wool on the radiator.
Okay.
Yeah?
Yeah.
Okay. Now, what other things would help with aromatherapy?
Dry skin and cradle cap is quite a problem at the moment.
Right, okay. Now, with both of them, or is it just the cradle cap with you?
They've both got cradle cap.
They've both got cradle cap still. Okay, rightio. Best thing for cradle cap would be a mixture of lavender, Roman chamomile and sandalwood. All three oils are calming to the skin and regenerative, which means skin regenerative, regenerating new cells, okay? Now, the sort of mix you want here, obviously you don't want to burn them, you want to apply them directly onto the skin.
Yeah.
Now, what I'd like to do is mix something for you that you can use on both of your children rather than having to dilute it more for your baby. So the sort of thing would be a lotion, say a white lotion, which is for sensitive skin, a nice pure white lotion from the Shirley Price range. And I would add the three oils I've mentioned, Roman chamomile, lavender and sandalwood. Mix them together, say 1 drop each in 15 ml of white lotion.
Right.
Okay. And mix them together, and that will give you quite a lot of lotion. Actually, you'd be able to do his whole body if you needed to, if he has dry skin, for instance, eczema, psoriasis, sunburn, even just normal dry skin after a day outside. And also on the scalp, no problem. And even, obviously, I imagine he's got quite a full head of hair now, so even through the hair, no problem, just put it straight in.
So do you just wash it out the next morning?
You can, yeah, and at least then he's had it on for 11 or 12 hours overnight. That'll be wonderful. And you'll notice a change pretty quickly with both of them.
Okay.
You know, even within a week, I imagine you'll notice a big change. Do they scratch and itch at all, or...?
My son does, yes, the older one.
Yeah,
yes.
it's a shame, isn't it? So especially to stop the itching, the scratching, to stop any reddening and the irritation, it's nice and calming. Roman chamomile is wonderful for children. Again, there's quite a few chamomiles and Roman is the mildest.
Right, okay. What about bumping? He's always bumping into things. Is there anything I can put on the skin?
Good old lavender. Now, again, there's quite a few lavenders, and the lavender I would recommend is one. The Latin name is Lavandula angustifolia. Okay. Now, when buying an essential oil, it's very important that you look at the Latin name. There's lots of cheap lavenders out there, lavender being the most popular one.
Yes.
So buy Lavandula angustifolia, and you know you're getting the best one. And obviously make sure it's neat and not blended, not watered down in any way.
Right.
It's worth spending the extra money.
Okay.
Okay, and then you carry that in your handbag. Okay, you've got it on you all the time, that means. Obviously you only need a little bottle of it, and if there's any bumps or any bites, mosquito bites or grazes, or any sudden crying, you know, for no reason, or tantrums, etc., you just get the oil out, put a drop in your hand. You might like to try it now. There you go, and mix it into your hands. And either, if he doesn't like it or if he doesn't want to be touched at that time, you can just waft it around so that he can smell it. It's quite strong, isn't it, when it's neat? And or straight onto the bump, the knee or the elbow, whatever it is. The wonderful thing about lavender is it will heal very quickly. It leaves no bruising or scarring, and it takes all the pain away. So if you were to waft it around, he'll probably stop crying fairly quickly. It also stops the bleeding. If you put lavender, doesn't matter, you can put it neat onto an open cut, it can be bleeding.
Doesn't sting them?
It doesn't sting at all. I've used it on my daughter hundreds of times, and on myself. So neat onto an open cut, and it stops the bleeding. Absolutely wonderful. Now, what about in the evenings? What's your evenings like?
I was going to ask you about that. Once we've actually got the children off to bed, my husband and I can be fairly exhausted. I just wondered if there's anything, and with the children, that can settle us all down for a good, calm night's sleep.
Absolutely. Aromatherapy, that's where it really comes into its own. There's a lot of essential oils which help with the physical side, aches and pains, but also the mental side, stress and calming the children and yourselves down after a stressful or hectic day. Now, one of the best mixes of oils that's already mixed is this one, which is the Shirley Price Care for Stresses and Strains. It's already mixed up and it contains a mixture of essential oils, especially for this reason, which are basil, juniper, lavender again, and sandalwood. You'll probably hear a few of the same names of oils coming up again and again, and that's because a lot of these are good for children, nice and calm and mild for children. Basil and juniper, again, very common oils and lovely to use around the home. So again, you might like to burn it so you all get the benefit of it in the evening, or you might like to massage each other, the children as well as the adults. It's a nice feeling just to have that touch, and then you'll feel and smell the oils going onto your skin, and then you'll have it on you all night.
And is it okay for a baby to have the same oil massaged on her?
I wouldn't use the same dilution that you would on the adults. I just put 1 drop in, say 5 ml or even 10 ml of the carrier oil, and you can do a lovely baby massage with that quantity.
Wonderful.
Okay.
Yes, thank you very much.
No problem at all. Annie, thanks for coming in today. We're going to be talking about application of essential oils and mixing them with lotions or oils. Now, in the past, I know that you've had a little problem with dry skin, and what we've done before is mixed up essential oils with a lotion. How has that worked for you?
It's worked very well. I have to use it every day because I do have chronically dry skin, but now it's much better than it was before. And also, you very kindly give me different smells each time, which brings the changes.
Yes. So not only are you helping your dry skin by applying, say, a lotion or even a massage oil all over the body to the skin every morning or every night, sometimes both, but also you've got that beautiful perfume of the oils that you're applying, and sometimes I know that you can smell it all the way through the day or through the night.
Yes, that's right, and you choose, if I have a particular problem a particular week, you choose an oil that goes with that, and presumably it's helping that as well.
That's right. That's the best thing about essential oils, and the holistic approach is to vary the essential oils depending on the presenting problems, and one person will be different from one week to the next depending on bumps or illnesses or family problems or germs that are going around. So it is nice to bring in oils, say for hay fever in the summer, for coughs and colds and the winter problems, and then again maybe the evening one to help you sleep, and the day one for waking up the muscles and giving you a bit more energy in the daytime. So let's just put together one of the oils I've put together for you before. I'd have used a white lotion, as so, and then say if it's a daytime one, I might have mixed up some oils like juniper, rosemary, there we are, a couple of drops of each, and sweet marjoram. Now all of these 3 oils, juniper, rosemary and sweet marjoram, are excellent stimulants for the muscular system. Right. They wake the muscles up, they warm them, and they boost the circulation all over the body. best thing about essential oil is that it doesn't stay on the surface of the skin. It will go through the skin into the circulation. Therefore, even if you simply put it on your arms, because it's going into the circulation, it will go through the whole body, and your whole body gets the benefit of it, because the molecules of essential oils are smaller than that of lotion or a carrier oil. So if I mix this up for you, maybe I can apply it to one of your hands and see what you think of the aroma. It will be quite strong at first, okay, but of course as the essential oils go into the skin, it won't hopefully be as strong, but people will know that you've put it on. Oh, what's that lovely aroma all day. Okay, what do you think of that?
That's wonderful. Very refreshing.
Yes, it is, isn't it? They're really nice oils to use. Okay, so that's one that's good for the muscles as a daytime use. Now, other ways of applying essential oils to the body. Now, I'm not talking about neat, I'm talking in with, say, a shampoo, conditioner, massage oil, or a body lotion, face lotion. Another way are the shampoos. There's a range here for greasy, dry, and for normal hair, and these shampoos come with oils especially for that type of hair. So for instance, the dry hair one contains lavender, patchouli, sandalwood and tea tree.
Right.
Now in the past I've made you shampoos up for your children, haven't I? What was that for?
That's right, they were coming home quite often with having contracted head lice at school, and we were always getting letters saying that head lice were coming round again. And I'm not sure which shampoo you mixed, but you put something in which really does help. I can smell it once I've dried their hair, and it probably lasts a few days, but it does seem to stop them getting head lice as often as their friends.
Super. So you don't use it every day, you use it twice a week or something?
Probably just whenever they happen to need their hair washing. But I don't know which of the shampoos you used. Do you have a particular one that's good for children?
I make my own up. I use a base, a nice natural base, and then I add essential oils, particularly for that reason, for that client.
Right.
So for instance, for prevention of head lice, I would use ones like juniper and rosemary. Head lice hate rosemary apparently.
Right.
Another one is eucalyptus or peppermint. Absolutely wonderful. If you were to go into a chemist and buy a head lice shampoo, you'd probably find it would contain ones like tea tree. Tea tree is wonderful, and it is antiseptic, antiviral, antifungal, but it's quite a mild oil. And head lice, as you may know, get used to the smells and chemicals contained in head lice shampoo, and so the pharmacists have to change the ingredients every couple of years. The same with tea tree, they can get used to it. So again, with the shampoo I make for your children, perhaps I could vary it once in a while.
That it's making a difference, right?
Yeah, okay. And again, there's a nice conditioner that can go with that. Okay. Now, moving on to aches and pains. Now, I know in the past you've had the odd problem with skiing accidents.
Yes, I've got a very poorly knee after skiing and falling several times. It's nothing that can be operated on. It's the ligaments are just very poor. I don't know if there's anything you can do to help that.
Yes, absolutely. The best thing for any joint is a compress. Now the way you'd use a compress is you'd mix your essential oils as normal, there's just the same dilution as a massage. So for instance, 15 drops to 50 ml of carrier oil.
Right.
But that will make about 3 bodies worth of massage. So you'd just need, for one massage, you'd need something like 6 or 7 drops to 15 ml. Of carrier. Okay, I can make it up for you, but this is just the dilution in case you want a small amount. And then you would apply it into your hands, massage it round your knee. You don't need to know what you're doing, just basically upward movements and thumbs upwards round the outside of the knee joint.
Right.
Okay. Once you've applied your essential oil, I'm talking all around the knee, underneath the knee as well, because that's where the lymph node is that eats away the toxins that come from the knee joint. You would then wrap it with cling film. Now the reason for doing that is it contains the heat. Another way of wrapping it is maybe with a warm flannel. Yeah. So you'd have the warm flannel around it, but obviously that would cool quickly, so you'd have to keep warming it, keep putting it back on again. But again, it smells absolutely beautiful, and the oils go through the skin into the circulation, so helps in both ways. Yeah.
And how long would I have to keep the cling film?
Well, that's the funny thing. I mean, hopefully about 10 minutes should do it, but I'm talking every night, so just hope no one comes to the door while you've got cling film around your knees. But yes, just 10 minutes, but if you can do for longer, even better. And again, raise your knees and your legs so the fluid is drained back downwards, back to the trunk of the body, where again there's bigger lymph nodes which eat away the toxins, and that's what you need. Okay.
Would that be helpful for any other aches and pains, general aches and pains? And
compresses, yes, yeah. Again, it's particularly for joints, so elbows, even shoulders, around the ankles particularly, and the knees. They're the best way. If there's any inflammation, you would use a cold compress to reduce the swelling. But if there's no inflammation, such as arthritis and the sort of knee problem you've talked about, then you need a warm compress.
Right, so the next time I fall, I should have some with me, but use it cold.
Yes, if there's any swelling, absolutely. You put the oil on as normal, and then put a nice, if it's very bad, ice pack over the top of the flannel. Or just not even an ice pack, just a cold flannel. Depends how bad the swelling is really, but it will really reduce it. It's wonderful.
Thank you.
No problem at all. Okay, Wendy, how have you been since I've last seen you?
Not too bad. It's just now it's sort of hit hay fever season, so I've been suffering quite a bit with my hay fever.
Okay, and where is your hay fever?
Basically, it's an itchy nose and very runny eyes.
Right. There's something that's wonderful for runny eyes, which is a mixture of essential oils contained in a chamomile eye liquid. And the essential oils are Roman chamomile, fennel and rosemary, which are all wonderful for the respiratory system. And of course, eyes are part of the respiratory system. And the way you would use it, if you're the sort of person who can apply essential oils directly into the eye, is you'd take the dropper out, make sure you've got some liquid in the dropper, and literally put one drop in each eye. That's all you need. It's quite strong when you first put it in. They're not neat essential oils, obviously. They're very much diluted. And the essential oils will help to refresh the eye, they clean the eye, and they help prevent hay fever. It's not just refreshing them and getting rid of that horrible itchy feeling and the runniness, but it's also helping to prevent. So the way you'd use it is maybe you'd use it twice a day during the hay fever season. Okay. The only time you can't use them is if you wear contact lenses, which you don't,
I
do
don't,
you?
just glasses.
No. Yeah, that's wonderful. Okay, so that's the best thing for hay fever eyes. Now, you also mentioned your nose as well.
It's itchy.
Itchy and runny.
Yeah, it is slightly runny, yeah.
Yeah, okay. The sort of thing then would be something you could inhale. The sort of oils I'd be looking at would be rosemary, eucalyptus, again excellent for the respiratory system, and rosemary, excellent for breathing and respiratory, and some sandalwood. Now, sandalwood is a base note. All oils are divided into three categories: base, middle and top notes. Base notes mean that they are not very volatile compared to top notes. So a base note will fix the other two oils, meaning that it will hold them for longer. And then once you've mixed those together, perhaps in a carrier oil concoction, you can rub it onto your hands and inhale it as so, like this. Maybe 2 or 3 really big inhalations all the way down to the lungs, and it will clear your nose and hopefully stop any itching and runniness.
Oh, that sounds wonderful.
Yeah, it's a really nice mix to use. You could always have it mixed in your carrier oil all the time, so you don't have to do it every day, and then have it in your handbag.
Oh,
and able to do it straight from your handbag wherever you are. Okay, so tell me a little bit about what you do.
I've got a full-time job. I'm self-employed hairdresser, so it's quite a busy job, very stressful, and I'm on my feet all day. And I find I use my upper body most of the time.
Yes.
And I get quite a lot of tension in my shoulders.
Right, okay. Well, I can understand, obviously you're on your feet all day, you probably don't give yourself any breaks.
No.
You probably work Saturdays as well, do you?
Oh, yes.
Yeah, okay. Well, the wonderful release for shoulder tension is a mixture of, say, sweet marjoram, rosemary again, and lavender. Lavender will calm your shoulders, excellent analgesic, which is pain relief. Rosemary, excellent stimulant, good for the circulation, and that's what you need, because you need the circulation to come up to the shoulder area and bring the blood there, which brings the oxygen and nutrients ready to heal the area, whether it means antispasmodic, which means releasing any spasm in the muscle and the ligaments, or whether it's decongesting in case there's any congestion and any toxins in the shoulder. Okay, sweet marjoram again, wonderful oil to use, again for the same reason as rosemary, and because you've got the two there with the calming lavender, it's a nice mix to use, smells beautiful, and you'd be able to put that again in a carrier oil mix, say sunflower oil. Mix it together and put it up straight on the shoulder. So for, say, you'd only need about 5 ml, which is 1 teaspoonful of carrier oil, you'd put 1 drop of each, and that's maximum. So if you're making more carrier, as you would do for your handbag, for instance, you'd be putting, say for 50 ml of carrier, you'd be putting in total 15 drops of essential oil, so say 5 of each. Okay, and that's a wonderful oil to use in situ in the salon.
Right, would it be okay, because I'm very sensitive, I've got very sensitive skin.
Ah, right.
So I have to be quite careful.
Good point. In that case, I'd reduce the dilution by half. So instead of 15, I'd use 7. In 50 ml of carrier, and also I would only use oils that are not sensitive to the skin, they're not aggressive or irritant to the skin. So the ones I've talked about, sweet marjoram would be alright, rosemary I would not use, and lavender is wonderful. Okay, so instead of rosemary for your shoulders, which is I'd think of one that's a nice calming one, I would use one like tea tree. And because you're using half dilution, that should be all right, but what I'd always say is try it on the inside of the arm first before you put it anywhere else, and then if that's okay within say 24 hours, you can apply it anywhere else.
Right.
If it does react in any way, then bring it back into me, or go back home and dilute it even further yourself. Okay.
I know I'm allergic to wheat and dairy products, so would that make any difference to any oils I may use on myself?
Well, worth mentioning that. There's a carrier oil which is called wheat germ oil, and I would not use that on you. Obviously it's taken from wheat, and if you're got any sensitivity to wheat at all, I wouldn't apply it to the skin, because again, a certain quantity of it does go into the skin and even digested in the gut, so you might have a reaction to it.
Okay.
But with most carriers you're fine, such as sunflower, and another beautiful one to use for you would be calendula, which is made from marigolds, hence that beautiful colour.
Good rich colour, isn't it?
It is, and it smells lovely as well. And that's wonderful for calming irritated skin or sensitive skin. The other thing we wanted to talk about today was Care for Clear Head, which is excellent for headaches, and perhaps you might just like to try this with me now. 1 or 2 drops in the palm of the hand, briskly rub the palms together, and 2 deep inhalations. And that way it goes straight to the olfactory bulb, which is behind the nose here, which sends a message to the brain, which tells the brain a different message depending on what the oil is. In this case, it contains lavender, sweet marjoram, eucalyptus and peppermint. The peppermint you're probably now tasting.
I can.
It goes all the way down the lungs as well, even to your ears and down your nose and your eyes, make your eyes water. Really wonderful oil to have in your handbag for those head tension times.
Well, yeah, because you never know when you're going to get one. And I get quite a few at work, and that would be very ideal because I could do that within 2 seconds rather than taking paracetamols and things like that.
Yes.
That would be ideal for me. Much
Wonderful.
better.
Good, good. Well, good luck with it and I hope things improve.
Okay, thank you.
So Jackie, what we're going to do today is demonstrate a facial. I'm going to use a whole range of cleanser, toner, a massage, then a mask, finishing with a moisturise. It's a nice range of products, but just I need to know a little bit about your skin type first of all.
My skin's greatly improved in the summer, so I've just got a few dry areas around my nose, but everything else seems to be okay.
Right, because we used to have to deal with a little bit of dry skin around the whole face, didn't we?
Yes.
Yeah, and that's gone now.
Yeah, it seems much better.
Wonderful, okay. Well, I'll use the cleansing cream, the moisture cream, and the honey mask in that case.
Okay, lovely, thank
Okay.
you.
I'm just using some cleansing cream here to take any makeup off. Just a little bit around the eyes and underneath. Very sensitive area, we have to be careful around the eyes. And then a little bit on the lips. There we are. As you can see, keeping contact with the skin all the time. Always making sure one hand is in contact with the body. The cleansing cream does an excellent job of taking makeup off, not just cleansing the skin. And a little bit round your lips. What I'm doing is just pulling the skin to one side so I don't stretch it too much, just by taking the makeup off by itself. There we are. I have some cleansing cream here, just dotting it around the face, always including the neck, and up around the eyes. And then using some nice sweeping movements all the way up the neck and over the chin. Up each cheek. Particularly around the nose area. And up the forehead. It's a nice feeling to be massaged around the eyes. Very relaxing. We have a lot of muscles and nerve endings around the eyes, and it just feels wonderful to have that area massaged, finishing at the temples. Now I'm going to take the cleanser off with a Melissa freshener. Melissa is excellent for dry skin. And it smells beautiful. In the same pattern, going up from the neck to the chin, up the cheeks, the nose, the forehead, and finally round the eyes. And at this stage the skin feels very fresh, having had the makeup removed and the cleansing cream taken off. The next stage is a nice massage. Now that the skin's nice and clean, has no chemicals on it or synthetics. I'm using here a sunflower oil with some calendula oil in it, and the essential oils I'm using are lavender and Roman chamomile. Probably, Jackie, the strongest one you can smell there is Roman chamomile. Yeah, and it's, again, both of them excellent for sensitive skin, dry skin. It helps in the repair. They contain something called esters, which help regenerate skin and balance the skin. Okay, I've applied the oil. Now I'm going to do the massage. Some nice strong sweeps up the neck, all around the neck. Removing toxins from underneath the lower lip. And coming up the cheeks in a heart shape here. Nice strong movements. Always pressure coming upwards. Over the nose, up the forehead, stretch the forehead out, removing any wrinkles, and around the eyes, just with one finger. Now going to apply some acupressure moves, working up the forehead. It is possible to actually apply quite a lot of pressure at this stage. The forehead is obviously very bony and can take a lot of pressure. We have a lot of nerves and sinuses in this part of the forehead, and they feel wonderful when they're massaged in this way, particularly acupressure moves. They respond to a pressing movement in this way. As you can see, I've worked upwards in the centre, and now I'm working from the centre outwards, all the way up to the hairline, giving it a nice press. Down to the temples. Now I'm going to use my thumbs and stretching the skin downwards. So all the toxins that I have squeezed are now being pushed to the sides where the lymph nodes will eat up any toxins. Coming round to below the eyes, using 2 fingers to work on the sinuses. And here I'm breaking up any fluids in 3 moves, 3 sweeps with the 2 fingers. Like so. And then in the same way as I massaged the forehead, I've squeezed and now flushing out all those toxins. The next movement's a lovely rocking movement where I press down on the forehead and then 2 fingers around each side of the mouth. Down on the forehead, around the mouth. This massages the whole face in one movement. How did that feel?
Fantastic.
Good. Now I'm doing some more acupressure moves, using both of my thumbs on one point on the chin. At this point, quite often, people really relax, even if they've had a whole body massage and haven't been able to relax during. At this point, this acupressure point will allow them to totally switch off. There's another one just each side of the mouth here, and you hold just for a few seconds, and then again where the jaw ends, you can feel the ends of the teeth coming together here. That's your 3rd acupressure point on the bottom there. And then coming up, always in contact, switching fingers and moving round to between the eyes there. This is an excellent acupressure point for headaches. If you hold this point even on yourself when you have one of those headaches that's just coming, you should find it will go, especially if you have some lavender or sandalwood or peppermint on your finger at the time. Peppermint would have to be diluted though, because it can be an irritant if it's used neat on skin. And then find the acupressure point on the temples. And then coming up to the scalp. First of all, just introducing the hands to the scalp, working around the back, over the ears. Nice, slow but firm movement. The scalp can actually take quite a lot of pressure here, although what you don't want to do too much of is pull the hair so that it hurts. Just want to move the scalp more than pulling the hair, and particularly around the back of the base of the scalp here. Wonderful movement. And another way is to keep your hands on the scalp and move the scalp without causing friction on the hair. And you can do this by securing the head with one hand and working your way round with the other hand. And then some pulling movements at the end. And Jackie should be really nicely relaxed by now. Always pulling upwards and backwards. Okay, so I'm going to carry on by providing a mask. The mask I'm using here is a honey-based mask. Just like the cleanser, I'm going to patter it all over the face and the neck, making sure it's evenly dispersed, and then nice massages all the way up the neck. Over the chin, alternate hands on one cheek and the other. It's a nice feeling to lift the skin there. It feels wonderful when it's being done to you. And over the nose. Again, this one smells beautiful, very healing and excellent for dry skin. And that stays on for just 1 minute. Having waited a minute, just put some Melissa freshener on some cotton wool pads and gently applying it up the neck, simply to remove the mask. Under the nose and up the forehead. Now I'm applying some moisture cream, which is a beautiful colour. Nice yellowy colour there. It contains lavender, rose and geranium. spreading it through my fingers, and again the normal pattering over the face and neck, moving up the neck. Up the nose, paying particular attention around the nose area where Jackie still has a little bit of dry skin. Up the forehead and round the eyes. I always like to apply a little bit to the eyes here as well. My final application is a little bit of super light eye cream. As you can see, it's a slightly greeny blue colour that contains azulene. That's what gives it that colour. And it's wonderful around the eyes. You only need the tiniest bit. So just a little bit around the eyes and underneath. There can be the odd hair to remove. And the eyes like that. Wonderful. And quite often I've noticed ladies have slight redness around this area here and down their nose, and I've used super light eye cream in this area as well. Again, just the tiniest bit. And it helps not only reduce the reddening, but also to prevent it from happening in future. The sort of things that can cause it are acidic foods and drinks, which cause something called rosacea. So just massaging that in very gently around the eyes, underneath, and up the nose. And any reddening reduces immediately. And then I normally finish by just doing a few sweeps up the scalp and off through the hair. And just pulling the hair back again. Hopefully you'll have found this programme helpful and full of ideas for using aromatherapy to improve the quality of your life and those who are dear to you. Remember, aromatherapy is the controlled use of essential oils to improve the health of the mind, the body and the spirit. Also, I do have to say that to get the best out of aromatherapy, it is really worth visiting a suitably qualified aromatherapist regularly for massage and ongoing advice about using essential oils. If you'd like more information, there are further details and telephone numbers after the credits. Essential oils have become a vital part of my family's first aid kit, and at the first signs of tiredness or stress, there are plenty of options available that are side effect free and very pleasant experience at the same time. There's nothing quite like a warm scented bath or relaxing with the help of aromatic oils in a vaporizer to raise anyone's spirits after a hectic day. And one last thought, prevention, as they say, is definitely better than cure. So remember, you don't have to be unwell to give aromatherapy a try. There really is something of value to everyone. Hi, I'm Victoria Sprigg, and I'd like to introduce you to a complementary therapy called Swiss Reflex. As a holistic therapist, I use many different natural treatments, including aromatherapy and massage, which are perhaps more widely known. But in many circumstances, Swiss Reflex can offer the most effective techniques for stimulating the immune system in order to restore the body's healthy balance. Reflexology is fast becoming a very popular complementary therapy, focusing on the feet to access every part of the body. Swiss Reflex is similar insofar as it also applies treatment to the feet in order to care for the whole body, but it differs in a variety of ways. I trained in Swiss Reflex at the Shirley Price College in Hinckley in Leicestershire, the treatment having been developed by Shirley Price, who has been responsible for the advancement of this treatment throughout Great Britain and overseas. As you can see from these charts, each part of the foot corresponds to a specific part of the body, and naturally it's far easier, for example, to access the centre of the foot, the corresponding point for the liver, than it is actually physically to get to the liver. Also, there are not only the physiological aspects to consider, so it's necessary to think of the health problems in a broader sense. Just as with acupuncture and reflexology, the theory behind the treatment is based upon the meridians of energy passing through the body. If one of these energy channels is for some reason blocked or temporarily obstructed, then health problems tend to occur. With acupuncture, needles are used all over the body to restore the full flow of qi. With Swiss Reflex, we use pressure from the thumbs just on the feet, and the results can be equally as beneficial. The major difference between reflexology and Swiss Reflex can be seen at the outset. The first part of the Swiss Reflex consultation will be geared towards diagnosing what is responsible for causing any problems, and a relaxing corrective treatment follows. Essential oils are also used in each treatment, a different mix for each client. The best way to see how it works is in a practical situation, and I'm pleased to say that 5 of my regular clients have agreed to let us sit in on a consultation. Although you'll see plenty of ideas for the type of foot massage you can try at home, I would always advocate seeking professional advice, and at the end of this programme there will be a selection of further information and telephone numbers to help you find a suitably qualified practitioner within your area. Throughout each session, I will always give advice on how to continue treatment at home between appointments, as well as offering a selection of essential oils that may also be of help. Wendy, you've come in today for a Swiss Reflex consultation, and what I'm going to do is check both sides of the feet, now mainly the skeletal system. How Swiss Reflex works is that there are meridians of energy working through inside the body and ending up at all the extremities, so at the palms as well as the feet, the face and the scalp. And those energy lines, called meridians, will go through the body, and where the extremities are, at particular points, there will be reflex points. And if any of those points are painful in any way, whether they have a bruised feeling, they may feel gritty under the skin, or they may feel like a needle or a nail is going in, it might be quite acute pain, then that can show that there's congestion in that energy line. Now the energy line, as I say, goes through inside the body, and it will work through the organs, through the muscles, the limbs, the bones, the whole body. So in that way I can check the whole of the body just by looking at the feet, for instance. I'm checking the feet today because they're the easiest part of the body of all the reflexes to work on. And obviously it's easier for me to check your liver and your digestive system, for instance, which are internal organs, by checking on the feet rather than checking on the body. Okay, so what I'm going to do now is check your skeletal system. If I can just move your foot up to there, wonderful. As I say, if you feel anything as we're going along, bruised feeling, pain or whatever, let me know as we're going along. Okay. Having done several years of treatments now, I can feel myself just there. Okay. Okay. I can feel, as well as you're feeling, I can feel if there's any problems there. Sometimes more than you yourself can feel, because the nerves in my thumbs are more sensitive than the areas of your feet here, so I can feel any grittiness or bubbliness under the feet. So this area here is your spine, this being the centre of your body, working from the head down through the neck, the thoracic, lumbar and down to the sacral area down here. Now this area that you just pointed out was a little painful is the lumbar area. It's just equal to where your kidneys would be, but on the spine on your back in the centre. Okay, now coming round to your... That was painful, yeah. Okay, then coming round to your shoulders. That was your shoulder blade. This is your shoulder point. Yeah, you could obviously hear that. That was a click. But also, it's quite gritty in there. There's a lot of things moving around in there. The sort of pressure I'm applying, it's not too much, and yet it's quite firm. And obviously, I'm not using my nail. I'm just using the pad of my thumb. So if you do feel anything like a pinpoint pain, it won't be my nail, it will be a feeling from inside. Now checking your joints. Right, okay. The areas of pain then on the skeletal system were your lumbar, a little bit on your shoulder blade, quite gritty actually on your shoulder point. And then coming down on the joints on this side of the foot, we've got the elbow, the hip, and then the knee, just close together here. And it was the first one, the elbow, that seemed to be a little bit gritty. It's interesting at this point not to worry too much about anything that does arise, because these congested lines may just simply show a problem that may occur in future years, but we can do something about it now. Or it may be that you've banged your elbow recently. It might just be an acute problem and not something that's chronic. Right, let's check the other foot. I'm working up the shoulder blade here.
That's a little bit painful.
Yeah, a little bit gritty in there, I can feel that. A lot of people have grit in their shoulder blades. In their feet, that is. It shows me there's congestion in there, and again there, quite a lot in there.
Feel it now.
Coming down from the shoulder point down to 3 joints down here. The first one is the elbow on the bone. Yeah. Second one the hip. Third one the knee down here.
I could feel the hip as well.
Let's lower this knee. And check this side of the spine. Working down the left side of the spine, all the way down from the neck. Painful there. That's interesting. It's slightly higher up than it was painful on the right side of the spine so far. Yeah, and I felt a little click there. Did you feel that?
Slightly
Yeah, yeah. That is the whole of the inside left side of the spine, and this is the sacral area going round at the very bottom here to the coccyx. So this is right at the base of the spine, almost at the top of the buttocks. Now, if we were to work round the buttocks, this would be this area, and also, once I've just checked the shoulder blade, I'll show you on the other side.
It's very uncomfortable.
Very, more so than the right side. Yeah. Okay. And coming round, I'm now going to check the sciatic nerve, which, because there was some pain on the lower back and the buttock, I'm just checking to see if it affects the sciatic nerve at all.
Yeah, just where you press last.
The very last one.
There, yeah.
That's interesting. This is obviously on the left side, and it's the sciatic nerve that runs from the centre of the buttocks here, this sciatic point in the spine, and then down both legs. So obviously this is going down the left leg. And that's quite a long way down the left leg. That
I get a lot of a discomfort down my leg
right.
from my back, so that's probably why it shows there.
Yeah, well, that would tally because that's where it's painful. So in a treatment, that's when I would treat that part of the foot to try and help the pain and prevent eventually that sciatic nerve from being squeezed, which is causing the pain. So coming round, checking the shoulder point, again very crunchy there. Down the 3 joints, that was your elbow again, hip and knee. Elbow's the worst, but the other areas are fairly crunchy. You could do with a really good massage on the feet using the Swiss Reflex points, particularly on the skeletal system, by the look of it. So what I'd like to do is treat your spine, your shoulder blades, and your sciatic nerve.
Right.
Now, the best way for me to treat you is using essential oils in a cream which is oil-based, so it's a wonderful lubricant for the feet as well. And I use essential oils specifically for the skeletal system. Now that will include rosemary, black pepper and lavender. Similar oils which I would use in aromatherapy in a massage. I'm mixing some Reflex cream with a drop of rosemary, or 2 drops, and some lovely black pepper, both very stimulating. That's what we need. We need the circulation to be boosted in that part of the body. And some lavender. Beautiful. And mix them together. The beauty of essential oils in a cream like this is that they will mix straight into the cream and not separate. So once they're mixed in, that's it. Wonderful.
It smells really strong, doesn't it?
It is very strong. Let's just try a little bit of it, if you don't mind, under your nose. Is that all right if I put a little bit there? There we are.
Lovely.
And then you can smell it during the
Clean
treatment.
sinuses.
Yeah. Quite often people have oils treated on the feet, and during the treatment, even though they haven't had any put on under their nose, they can smell it. Yes, because it's coming through the air, but also it works through the circulation as well.
Right.
Amazing. Just put that on there for a second and apply this cream all over the foot, in between the toes, and a little to the other side. Feels nice, doesn't it?
It's lovely.
Yeah.
It's really nice.
Lovely. So, working on your right foot, a little bit of a massage to warm the foot up, introduce my hands to the feet. In fact, this is very important for those who feel a little bit sensitive about their feet and showing their feet to a therapist. I know it can be quite a hurdle, and also for the ticklish side of it. So what I do is I treat the feet very firmly. I don't tickle them or I'm not a delicate touch at all, quite firm. And with the diagnosis as well, with the massage, I'm quite firm, and that tends to help.
Yeah, it feels really nice.
Lovely.
Not ticklish at all.
Okay, what I'm doing now is working down the spine, exactly the same areas that I was working in the diagnosis. And the slower I go, the more I feel, probably the more you feel. And the more I do this, you'll probably notice more feelings will come out in the feet. They may go grittier, and that's exactly what we need, because we need the grit to come out, any of that. So, did it feel gritty to you, or was it a bruised feeling, or how exactly did it feel?
In places it was gritty, and in other places there was actual bruise and feeling.
Yeah. But it is a wonderful feeling to have your feet massaged. Having said all that, it's just lovely to have all of that.
Yeah.
It's very relaxing. Of course, you've got the aroma at the same time. But also, it's nice to get rid of any pain, you know, whether it's in your back or whether the actual pain is in your foot or anywhere. And you know that when you're having this done, it just feels like it's all going, all that pain is going. And when you walk away today, your back should feel 100% better.
I hope so. It'll be nice.
Yeah. I recommend that you use these oils between treatments. Just coming onto your shoulder blade here. Between treatments, I'll give you a little pot of oil to use, and then come back as regularly as you can, say fortnightly at first, going to monthly, and I can massage these areas, and that will help your back, sciatic nerve, shoulder blades, etc. a great deal.
Amazing.
Yeah.
Amazing.
Lovely. Feel all that grit
Yeah,
coming out in
very
there.
much so,
Yeah. Using my thumb quite strongly in here. The feet can actually take quite a lot of strength. Lovely. And then coming round to the sciatic nerve. And up the length of the nerve down the leg. Might use my finger for that part.
That is
Really
very
painful.
tender, yeah.
Yeah, okay. Well, I'll be sensitive to that then. I'll just sweep it several times to get the pain out. Now, all this time, the oils are working through the skin into the circulation, the essential oils, the black pepper, rosemary and lavender. So it's not just the massage that's helping you now. And the beauty is it will go on helping you when you leave. It's not just this an hour and a half now. It's actually once you've left. And over the next couple of days, those oils will help.
It's lovely. I feel
Good.
quite sleepy.
Lovely. A little bit more oil. Coming round to the other foot and working down the spine. Exactly in the same way as on the other side. Lovely. There's a lovely channel working down the inside of the foot here, which my thumb naturally falls into. It feels really nice when it's healthy and strong and no grittiness there at all. Just nice long channel. And working up the inside here. The reason I don't work all the way down in one continuous flow, I work downwards to this point and then upwards to this point, is because your bladder is actually on this point here, and I wouldn't want to put any pressure on your bladder.
Oh,
so I just miss out that little hump in the centre there. If I was checking your excretory system, I would check your bladder, but I wouldn't during the skeletal system. Lovely, that feels better already there. Nice and smooth. Coming up to the shoulder blade and working nice and deeply in the shoulder blade called the scapula. Nice massage there. Have to be quite careful with this area because the heart overlaps it just in this area here, so I wouldn't want to press on the heart, obviously. That's one area that we do avoid during treatments. And across to the shoulder point. I'm supporting your foot here because I'm applying quite a lot of pressure. Does that feel okay? It feels like brown sugar. That's the way I describe grittiness. It feels like thick sugar under the skin, all moving around. And they're crystalline deposits. That's what I need to move and get rid of.
It's amazing.
Yeah, and the immune system will eat them up, but they need to be stimulated to move around, and then they'll be eaten up. Lovely. And a nice quick massage to finish up. Got nice warm feet now. There you go.
It's lovely. Very relaxing.
Marianne, now you have a little bit of pain in your neck area, don't you? Just tell me a little bit more about it.
Well, periodically I have trouble here. My neck gets quite stiff and pain just below the back of my head.
Yeah, so quite high up then. Yeah. So does it work down into your spine and into your shoulder blades at all, or is it just...
Not usually. It's usually sort of just the neck. It maybe sometimes extends down my neck.
Right. And mainly on your right side?
Yes.
Yeah.
Yes.
And what's it caused through?
Probably children going around when they're little.
And what about using the PC, head down, anything like that at all?
Also at work, carrying sort of computer bags and this sort of thing.
Yeah,
and
so it's carrying.
And you always carry it in your right hand.
Yeah, okay, rightio. Well, there can be a lot of advice about carrying and posture as well, which I'm sure you've heard before, but it all makes sense. If you can carry any shoulder bags with long straps across you rather than just on the one shoulder, that helps.
Right.
Because you're not then raising your one shoulder to carry the whole weight, and that will go straight up into your neck. Quite often, people with neck tension get headaches as well. So, do you get headaches?
Only very occasionally.
Oh, you're lucky. Very
Yes,
good. Excellent. But that's just something to be careful of, that it doesn't get so bad that it gives you headaches or migraines. Now, looking at the feet, the area where the neck is, looking at your right side, which is the main side that you do have the neck pain, is looking here, just at the base of the big toe. This would be the spine here, the very top of the spine. So it would work from here and round to the side of your neck, in between the toes here.
Right.
And again, the same on the other side, but obviously that's mainly the left side of your neck, round the back and round the side of the left side. Now, before I test and treat the neck area, I just want to ask you a little bit about your feet. Now, it looks like you've got a little bit of a fungal infection there, is that right?
Yes, yes.
And how long have you had that for?
Oh, quite some time. Yes.
Weeks, months, years?
Yes, probably months.
Yeah, months,
Yes,
yeah.
yeah.
Fungal infections are really difficult to get rid of once you've got them. It can be a sign of candida, which is very common in ladies and sometimes in gentlemen as well. Candida is a yeast infection in the digestive system, and because it's fungal, it has spores, so it will develop into other areas of the body, not just the digestive system, and eventually lead to other fungal problems. For instance, fungal infections on the toes, very common, also thrush, cystitis, thrush in the mouth, and it's not necessarily an adult infection. Children and babies quite frequently get it as well, so it's something that can be treated with complementary therapy, with essential oils, which would include red thyme, but red thyme you can only get from a therapist, but it's a very strong oil which helps with fungal infections. Wonderful oil to use. Also tea tree, which you can get in shops, wonderful oil again, and it is antifungal, so again will help with this type of fungal infection. And all you do is massage it in a cream all round the toe area, and in fact the whole of the foot. If you were to do that twice a day for, say, well, as long as you've got it, but even within the first 2 weeks you will see a change.
Right.
Okay.
Yes.
So that would be good. I'll give you some of that to take away. Now, going back to the neck area, I'm going to do the diagnosis first of all, just using my thumb, so holding the foot back, just relax your foot, wonderful, using my thumb round here and in the inside. It's crunchy just there, can you feel that?
Oh, yes,
yeah?
yes.
Okay. That's exactly where you get the pain. If you think about it, that's on your right side, just before it comes around to the side, just at the back there. That's exactly where it is crunchy.
Yes.
Yeah, it's actually tweaking as I go over it there.
Yes.
Yeah? Now, these diagnoses normally do tally with problems in the body. Sometimes they don't, and it may mean there's some congestion that's to come out, and a treatment will bring the congestion out before any symptoms will show, which is wonderful.
Right.
So it's nothing to worry about if any other tweaks happen that you don't feel in the body.
Okay.
So let's bring your foot down, and I'll check the other side of the neck. Just going around with my thumb a couple of times. Fine. No tweaks, grittiness in that side. How about you? Did that hurt at all?
No.
Okay, so I'll concentrate on this side. So I'll just mix up some oil using the red thyme and tea tree, and then use the oil around that side of the foot.
Okay, thank you.
Got a lovely mixture of tea tree and red thyme here, mixed into a Reflex cream, massaged all over both feet. I know I'm only treating the neck, but it's nice to do the whole foot, get the circulation working, and make the skin feel good at the same time.
Oh, yes.
Yeah. Nice firm movements. And now coming round to the neck. Now, people's reaction to a treatment on a sensitive area on the body can be the same on the foot. So this may bring out painful feelings on the foot,
Right.
but people describe it to me as a relieving pain. It's
Yes.
something that they know is helping, and it just feels wonderful. I mean, obviously the massage itself feels wonderful anyway, and using the oils, but they know that that grittiness or sharp pain, or however it feels on the reflex point, will be relieved, and it comes out, and then it just gets better and better. And that's during the treatment, let alone afterwards.
Right,
Yeah.
okay.
And normally a treatment would last an hour and a half with Swiss Reflex, and I'm working just around the foot here. I'm not working too firmly at the moment, this is actually quite gently, and I'm working around the whole of the neck, concentrating all around the back of the neck here, coming round to the painful point. Just relax your foot, lovely, and on the side of the neck. So I'm decongesting the whole area. One more point to make about relieving fungal infections and whether it does stem from Candida or not is diet and nutrition. To avoid as much as possible, I know it's very difficult, but as much as possible, anything which is fungal or yeast. So for instance mushrooms,
Oh, right, yes.
and yeast obviously is in lots of food, risen bread, alcohol, and if you did, it would stop feeding the Candida and therefore help any infections disappear.
Right, okay.
Wonderful. How does that feel?
Yes.
Yeah, okay.
That's great.
Right, nice massage down there, and on the other foot, not to leave it out. And I recommend coming in for treatments weekly to get rid of that. Okay.
Yes,
And then
thank
going
you.
to monthly once it gets better.
Thank you very much.
Alison, what we're going to do today is give the feet a really good detox. This will stimulate the immune system, i.e. the white blood cells, to rid the body of any toxins, crystalline deposits, any bacteria, etc. that can collect in the body, around the lymph nodes, all around the body. And so what we'll do is stimulate the lymph area here, on the top of the foot here, and also around this area. This one is the inguinal lymph node, which relates to the groin lymph node, which takes all the toxins away from the lower half of the body. And this lymph node here is the cervical, which is up here in the chest, and that takes all the toxins away from the upper half of the body. So that way we're working on the whole body and really giving you a good detox.
Great,
All
thank you
right.
very much.
Yeah. So we've checked your feet and we've found that you'd have no specific health problems at the moment. All the systems of the body are working well, digestive, skeletal, muscular, etc.
Yeah.
And so you've just come for a general detox and for good health.
Good health, definitely good
Okay.
health. I'm ready for my holiday.
Okay, right. The oils I will mix, which are good for stimulating the immune system, are sweet thyme, lavender, and juniper.
Okay.
Okay. Having applied the oil, it smells beautiful, doesn't it? I'm going to massage the feet, give them a really deep massage, and over the top between the metatarsal bones here. Sometimes that can be a little bit painful, but you need to clear away any toxins. Then round the ankle, and even give the ankle. Just relax. There is a tendency to do this for me.
Yes, I do find relaxing difficult.
Yeah, it can be at first, and then you get into the swing of it. Coming around to the other one, nice rotation.
And relax a bit more.
Yeah, this is the foot that was broken, wasn't it?
That's right. And it doesn't tickle, which amazes me.
Yeah, and just relax. Lovely. That's good actually, because a lot of people would think that it would.
It doesn't at all.
No, you need a nice firm touch and nice flowing movements and continuous touch as well. That's important. Right, coming round to the lymph node here, I'm holding the toes back and just pushing it upwards. First of all, a few feelings. And how does that feel? Does that feel any grittiness or pain there at all?
Absolutely nothing. It just feels very nice.
Good, okay, so no problems there.
No.
But it's still a good idea to release any toxins in case. Working on it at the same time as diagnosing, which is unusual. Normally I diagnose first and then treat separately half an hour later, but with this time there's no problems there. I'll treat at the same time. Then coming round to the ankle. There we are. Lovely. How does that one feel?
Yeah, no problems there at all. Feels fine.
This can be painful around the ankle joint here. We do harbour a lot of fluid around this area, swollen ankles, etc. But in your case, they feel fine. It feels okay to you?
No pain at all.
Wonderful. And I'm again in an upward movement, massaging fairly firmly, just with my thumb, round the ankle bone and then up slightly on the leg, like so. That feels good. Does that feel nice to you?
Wonderful.
Yeah.
Absolutely wonderful.
Good. And then a massage again. And off. Coming to the other foot. Just relax your foot.
Sorry.
It's all right.
It's the relaxing bit.
Yeah, it is. It can be tricky to get the hang of, actually. Oh, actually, I'm feeling a few.
That, comparing with the other foot, this one I can feel you this time, whereas before it was very gentle, and this time I can feel a few sort of things. So that is my bad foot. So
yes, this is where you broke. It
Yes.
was about here, wasn't
Yes.
it? You broke the
Yes.
bone, but it's actually under here on the pad of the foot that I can feel. It's quite gritty in there. Now this is actually on your respiratory system. This is your left lung. Any coughs, colds, bugs going around at the moment?
Well, it's
Catarrh?
the usual old sort of sniffles, which I'm not quite sure is hay feverish or what it is, but
Yeah.
it's so cold and horrid that
Yeah,
just a little
okay.
bit.
Well, there's something there that needs to come out, so I'll just spend some time. That's the beauty of using Swiss Reflex, that while you're massaging the whole foot, you might find something in a completely different system of the body, like the respiratory system. So instead of concentrating fully on the immune system, I'm just doing a little bit on this lung.
I do find when you're doing that, on this foot particularly, I'm tensing a bit more.
Yeah.
So I realise I've
Yeah.
got to sort of...
Yeah, you're pulling against me.
Yes.
The
So-
more you relax, the more you will benefit, because as you can imagine, the muscles will tighten and I won't be able to go in as deep.
No.
That's good. I can feel it's loosening up already. So coming back to the top lymph area here, giving you a nice detox. Following this, you should drink plenty of water, which is good for detox anyway, but after any therapy session, it's advisable to drink lots of water. We should be drinking about 4 pints a day. Now, on top of any fruit and vegetables and salad, obviously very water retentive, that should come up to about 6 pints a day. And if you can, filtered water or bottled water as opposed to tap, which is full of horrible things like bacteria and metals.
I bought one of those wonderful things that you can stick in the fridge and stick tap water in to filter it. So
Yes, yeah.
I'm conscious of it. Still haven't got rid of my 1 cup of coffee habit yet, but I'm working on it.
The 1 cup is actually more like a bucket, as I recall. First thing in the morning. It's going down.
in size, yes,
Okay.
It's,
I believe
smaller
you.
cup now.
Yes, but in general, for detox purposes, the less alcohol and toxins such as tea and coffee that you intake, whether it's food or drink. I mean, food-wise, you're looking at fried foods or refined foods, white sugar and white flour, etc.
Never touch them.
Good.
Not sure about the odd alcohol glass, but very little.
Yeah, very difficult to clear out everything that's bad from one's diet, but you know, the more that you can, the better, generally.
I think it's the coffee that's my biggest problem to give up, but I'm working on it.
Yeah. You'll see differences if you ever do, and if you were on 6 and now on 1, you'd see the difference between that.
I have. I've noticed a big difference, actually.
Lovely. How does that feel?
Absolutely wonderful.
Relax your foot.
That's it again, aren't I?
Very easy to do.
Very good.
Lovely. And a massage off. Barbara, you suffer a little bit with arthritis, don't you? Just tell me where it affects you.
Yeah, in my knees, and my hips, and the back of my neck.
Back of your neck and down your back at all?
Not really.
No,
not so
okay.
much. No.
So mainly the joint areas
Yes.
on your neck. Right. Looking at those areas on the feet, that would be around this area here, which is your neck. That's the right side of your neck, and here's the left side of your neck. And coming down to your joints, we'd be looking. That's actually your elbow, and then underneath there's your hip, and then there is your knee. Do those areas ache at all when I touch them?
You mean my hips and my knees, not my feet?
No, actually,
Yes.
in your foot as I'm touching them. Does that hurt at all? Whether it's a bruised feeling or spiky,
Slightly,
gritty?
but not a lot.
Not
No,
much.
Not
Okay.
at that level, anyway.
Right. Well, just put your knee up for a second. Lovely. And coming round and testing this side. There's your neck again on your right side. And coming down, elbow, hip, knee. They feel all right? A little
I can
bit
feel it,
in the
yeah.
hip and knee. Okay. Those are the areas I'll concentrate on today. Now also, a little bit of catarrh or possibly asthma at the moment,
Yes.
haven't you? And you do use an inhaler?
Occasionally, yeah.
Occasionally.
I try not to, but I do occasionally have to.
Yeah. So how does that affect you? Is it just in your throat and your chest?
Yes,
or-
it starts off like catarrh, and then I get a coughing fit. And if that gets out of hand, then I have to use the inhaler.
Right. I might just test the rest of the respiratory system while I'm looking at that.
Right.
So just doing a quick diagnosis here. I'm coming up the lungs. That's a little bit gritty. Coming up the thyroid here, because this of course is the...
That I can feel.
Yeah, and at the top is the parathyroid. This is the gland that controls the respiratory, so very important for you. These here are the sinuses. They just feel a little bit crinkly. And coming down with this foot, let's test the respiratory system here. So that's the lung again on the left side, very crunchy there. And coming across to the sinuses, just tweaking each toe. And up the thyroid.
That I can
one,
feel.
yeah, and parathyroid at the top. The parathyroid controls the thyroid. Another area of the respiratory is your eye on your left side and your ear. The same on this side, your eye and your ear. How did they feel?
All right.
Yeah. What I'm going to do is I'm going to do a mix which will help both the respiratory system and the arthritis. I'm going to put together peppermint, eucalyptus and lavender. The oil I'm applying here is mixed into a cream so that I can really massage it into each foot, applying a little bit more there. And you'll probably smell it already.
can.
Yeah.
It's lovely.
There's one that's quite lemony, which is the eucalyptus. It's a eucalyptus called Eucalyptus staigeriana, which is absolutely beautiful. It's one of my
It's nice.
favourites. Yeah, and it is a lemon variety of eucalyptus. Really beautiful. It's decongesting and good for muscle ache as well, actually. And also in there is peppermint, which is wonderful to use on the feet anyway. Lots of foot creams, etc., have peppermint in them, which are nice and cooling, but also very healing. Oh, I can feel a few lumps and bumps when I'm working up there. How does that feel?
Yeah.
Lovely. Just a nice massage, little rotation. Well, you're nice and relaxed. That's wonderful. Around the ankle. Smells nice for me here as well. Lovely. I'm working through the arthritis on the neck a little bit. And coming down and working through your joints. So it's not necessarily the elbow, it's just underneath, which is the hip joint here. Does that feel all right?
Yeah, that one isn't so bad at the moment.
Right, it's mainly the right one. And then underneath is the knee. These joints will vary from foot to foot because the elbow is here and this is on a little bone that's right there. I can feel it, and this is quite low in this foot, whereas underneath you've got the hip, and then underneath that, just a thumb width apart, is the knee. So it's actually very close to the heel, whereas normally you might find them a little bit higher up. So you always take your point from the elbow, which is that bone that you can feel.
Feel that way.
Yeah, and then underneath is the hip, nice massage there, and then the knee, again a nice massage. Another thing that's very good for treating arthritis, particularly in the knees or any joint, is to do a compress. Now this is when you would use the same oils which I've used today, maybe if it's particularly for arthritis, using more stimulating ones like rosemary, clove bud and black pepper. And massaging them in an oil or a cream around the joint, and then covering it with cling film or a hot towel, hot flannel, and that will keep the heat in, and it's just wonderful.
Yes, I've tried that. So
Yeah, good. And does it help?
Yes, it does.
Yeah, feels nice at the time, but afterwards it helps the mobility of the joint and any pain that's there as well. Lovely. And coming across to the other foot. Just going to raise that knee slightly. I feel comfortable.
Yes, that's fine.
Yeah. And working on the neck. And then round. There's that bone again, the elbow. That is a little bit crinkly there. And then underneath for the hip and the knee. Now, just bringing that foot down. I'm going to concentrate on the respiratory system, as I said. There's a little bit on the lung here to help any catarrh and coughing, wheeziness. This helps with hay fever, asthma, bronchitis, coughs and colds, flu.
I can feel it crunching.
Yes, so can I. And there again, this line here is the thyroid, and I'm pushing upwards. My main pressure is going upwards. So from this area here, all the way up, nice firm movement to the top. At the top here is the parathyroid, and I just give that a nice rotation, just concentrating on that one gland. Then coming up to the sinuses, massaging them all individually, and that helps the sinuses underneath the eyes and across the forehead. Lovely. Might as well do a little bit on the eye and the ear while I'm here. That's all the respiratory system now. And because they are all connected, one can affect another. So it is wise to treat a whole system rather than just concentrating on one sole area. Lovely. And a nice massage off and knee up again. Wonderful. And I'll now duplicate the area by doing the right lung again, a little bit crunchy. How does it feel to be massaged on that area?
That's okay.
Yeah,
That's all right.
It's not too painful or ticklish or no, good. It's quite interesting. You might see that Barbara has a little bit of hard skin in this area. That's quite common where there are physical problems in that part of the body where the foot relates to. So for instance, this is exactly on the thyroid here, and because Barbara has mild asthma and a little bit of catarrh, it shows that the thyroid needs decongesting. That's the gland which helps to rid the body of toxins. Just getting
feel
that
that.
up. Yeah, that's quite painful, isn't it? Yeah. And then again on the parathyroid. The thyroid obviously also controls metabolism and energy levels. By metabolism, I mean how fast you can metabolize food, but also whether you gain weight or not. Lovely. Working quite firmly across the sinuses. Wonderful. Now what you may notice after this is that the toxins that are being released through this treatment may stir up more side effect feelings immediately afterwards. So for instance, you may find yourself coughing a little bit more, or a little bit more catarrh or sinus trouble, for instance. And that is simply the toxins coming out. It won't last long, it won't be too painful, and it's a good thing that it happens because it showed the treatment worked. I know it sounds a bit backward, but it won't last long, and you'll feel much better than before the treatment once it's gone. And again, drink plenty of water and take it easy after the treatment. You may feel quite tired, which is fine. Just give in to it and relax.
I will do that.
The area I'm concentrating on today is the solar plexus, which is here on the foot and also here on the palm. Now, if you find that you're ever stressed and in a bus queue and can't make it down to massage your foot under here, you might want to just massage with your thumb, a nice circle in an anti-clockwise rhythm round in your palm. It's really relaxing, lovely to massage that area of your palm. And again with the other side, just anti-clockwise. Now, I'm testing the solar plexus here because I know, Alison, you're quite a busy lady, aren't you? And can get a bit stressed sometimes.
Tend to be, yes. It's a lot of activity with the work that I do.
What's the work that you do?
I work project management for exhibition stands, so there's a lot of toing and froing and getting things organised and remembering everything.
Yes, I see. And lots of standing on your feet, I imagine, as well.
Yes, during the shows there's a lot of pressure on my feet and thus up through the body as well.
Yes, okay. Right, so I'm going to test this area. Just going to feel with my thumb the solar plexus and down with this foot and test this area as well. Again, the solar plexus on the other side. Now, how did that feel to you? Any pain or grittiness or numbness there?
Not too bad. The right one was fine. The left one was a bit sharper, so there's a bit more pressure in that one there. On that side.
So I'll concentrate more on that during the treatment. Okay. Now, the other area I want to test during this diagnosis time is the digestive system. The digestive system starts here. I'm now testing the liver It's a very large organ of the body, and the gallbladder here. Tell me as we go through if you feel any sensitivity.
Okay.
Then across to this foot, I'm going to test the stomach.
Oh, that's nice.
Yeah?
It's quite sharp in there, yes.
Okay, that was this area. And just next to it, the pancreas. And again, I can feel a bit of
towards the end
grittiness
was
there.
very sharp, yes.
Yeah. Now I'm going to come down a little bit to the small intestines across the foot. And of course the small intestines are cut half and half through the feet, and they continue on this side of the foot.
Oh, that's getting sharp. The other foot wasn't too bad, but that one is
Okay.
a bit tender.
Now this point here is the ileocecal valve, which is the point between the small intestines, and it goes through the ileocecal valve up the colon, the ascending, transcending and descending colon down here. And this valve can get blocked, and if it's blocked it can remain open, so food can go the wrong way through, and people have quite a lot of pain down there. Because it's very close to the appendix, people assume it's appendix pain, but not necessarily. It might simply be that the valve's open, and that can happen regularly. It's not necessarily a chronic problem, it might just be an acute problem for a day. So it's wonderful to be able to massage that in the correct manner. So I'm going from the small intestines in this way and up, and then I'm just testing round the colon.
That's quite spiky as well.
Yeah.
That run through there.
And the other half of the colon, and down and out to the bowel. Yeah, quite gritty there.
At the end there, yeah.
So there was a few points there. We've got the stomach and pancreas, a little bit on the small intestines, the last part of the colon here coming out to the bowel, and the small intestines on this side, but it's mainly on your left foot, which indicates it's on the left side of your digestive system.
Right.
What I'm going to do is mix a few oils, for instance coriander, ginger and peppermint, which help with the digestive system. It helps with the flow and also ease any pain, and also they're very good for stress. So for instance peppermint is very good for any headaches and physical stress in that way, and the ginger is quite stimulating, so if you're stressed and feel low with it, ginger is quite a stimulant to spice you out of it.
Oh, lovely.
This is the treatment time where I'm massaging the solar plexus again in an anti-clockwise manner. Just relax your foot as much as possible. Wonderful. I'm going in quite deeply here. And
that feels good.
Yeah, good. And I normally find the deeper I go and the more time I'm massaging, that the crystalline deposits will come to the surface, and that's when it helps to get rid of them, and it will improve any pain or tension. This side wasn't the painful side anyway, it was the left side, wasn't
No,
it?
but it's coming through now actually.
Is it?
It's rising up, I can feel it, yes.
And over onto the other foot. How does that one feel?
It's funny enough that's okay actually.
Yeah,
well,
they've
it's not come
swapped.
through yet. Yes, it's not quite so sharp as the other one now.
Okay. Now I'm not using my nail at all, it's just the pad of my thumb, so there shouldn't be any sharpness unless it's from inside your foot with any energy pain there.
That's what I was feeling on the other foot.
Yeah. Well, that should help you a great deal, and you can continue with your palm massage if you need to between treatments. Now the digestive system. The liver was okay when we tested it, wasn't it? There wasn't any pain there. So coming across to this foot, working the stomach. Now this was quite sensitive earlier, so I'm going to be quite sensitive with my massage. I'm not applying too much pressure at the moment. And again with the pancreas. One area, of course, to be careful with the pancreas is anyone who's diabetic because of the insulin release. And it's an area that we can help a great deal, but you have to be very sensitive with that area and just use oils which will help a diabetic. And then coming down to the small intestines. Oh yes, a bit crunchy there.
Yeah.
More so actually than the stomach and pancreas.
Yes, it's coming through more now. It's not quite so spiky, but I can feel the crunchiness.
Yeah. And across to the small intestines on this side of the foot where it was a little bit painful earlier.
That's quite crunchy as well.
Now another part of the, if you like, digestive system, which I haven't tested yet, is the excretory system. Now, for any detox or detox for the whole body, not just the digestive system, it's very important to test this area here. Now, this is the bladder, working up the ureter. Yeah?
That's quite, yeah.
Up to the kidney. Now that, where my thumb is now, is a very sensitive part on most people. Most people have quite a lot of toxins in their kidneys, unless they're drinking gallons of water and not taking in any toxins at all.
I have been quite good lately,
yeah?
Actually, yes.
Good, okay. And then just above the kidney, and again it's moving around quite a lot here, this is the adrenal gland, which sits on top of the kidneys. You have two adrenals, each sat on top of the kidney, located about waist level in the back. And the adrenal gland secretes adrenaline and therefore is related to stress levels. The more we're stressed, the more pressure on the adrenal glands, and so it's wonderful to have that gland massaged. And then, as you can see here, I'm flushing out from the kidney, down the ureter and out of the bladder any toxins. It's a wonderful way to end a Swiss reflex treatment. You may find that you need the toilet afterwards, which is a good thing, release toxins. And also you may find that you'll be fairly thirsty, which is also a good thing because you need lots of water after a treatment. So coming round to the left foot. And again massaging through from the adrenal gland, the kidney, down the ureter and out of the bladder. That can be very sensitive, but again, wonderful relieving pain. That's great. So I hope you've enjoyed it.
Very nice, thank you very much.
And that's your feet done for a while.
Thank you.
When you first come across Swiss reflex, it can seem a bit strange to those only familiar with Western medicine that treatment to the feet can have such a dramatic effect on the rest of the body, but it really has proved to be of immense value to many of my clients. As I mentioned at the beginning of this programme, I am a holistic therapist, which means that I look at the whole body when someone is presenting a specific health problem, treating the causes of the difficulty rather than just the affected area. Swiss reflex is particularly good for stimulating the immune system, so many people find that as well as experiencing relief for their medical problems, they also discover that their general health improves dramatically, allowing improved sleep patterns, increased levels of energy, and an overall sense of well-being.